The crowd in if you want to kick us off.
Sure. Thanks, Olivia. Hi, everyone. So nice to see you all. I think we can move to our next slide. Appreciate you all joining today. As always, we love folks to introduce themselves in the chat. If you're able to add your name, organization, I'd love to know who's in the room. And I know folks love to connect during and after these meetings as well. Really excited for today's agenda. We're going to talk a little bit about Assembly Bill 1331. We're also going to spend some time on some major federal updates that have come down in the last few weeks, as well as additional state updates as we get closer to August. Before we move on, I do want to introduce, we have one new team member on the Connecting for Better Health team, someone that I think a lot of you might know, but I'm really thrilled to introduce Emily Cosio to you all, who's joined us at Connecting for Better Health. Emily, you want to say hi?
Hi, everyone. It's so nice to be here. It's so nice to see you all. I'm really looking forward to working with you all on Connecting for Better Health. Thanks, Stephanie.
Thanks, Emily. Okay, next slide. About Connecting for Better Health, I think most of you all are familiar with our coalition and our policy priorities. I do see a couple new names, folks who might be joining for their first ever Connecting for Better Health meeting. Welcome if this is your first time here with us. Here's our policy priorities that we discussed and decided on for 2024, data sharing agreement, education and implementation, funding, integration of social services data, and advancing DXF governance, enforcement, and accountability. Can jump right into our next item. Great. Yeah, I think we can go to the next slide. Thanks, Maya. So we're going to start off just with a quick check-in on Assembly Bill 1331. As a reminder, this is the data exchange framework legislation sponsored by Dr. Jim Wood that we've been engaging on for the last 2 years. For those of you who joined us in March for our Capitol Day, you heard Dr. Wood speak about this bill and his commitment to advancing it this year. So over the last 3-4 weeks, Connecting for Better Health has had some really great meetings with California Senate staff, also the Appropriations Committee consultant, and a few others to discuss the importance of the DXF and the components of this bill. We do expect some movement on this bill in August. So to prepare for that, are recirculating our support letter for the bill. So an AB 1331 support letter that you should have received this morning right before this meeting from Olivia in your email inbox. It pretty closely mirrors what we submitted as a coalition last year on AB 1331 as well. Thank you so much to all of you who have already signed on and shared your logo. Actually, even just in the past few hours, we got a number of folks who are eager to sign on and share their logos. We'll continue to collect sign-ons and logos over the next week. So we do have a Google form we'll add to the chat here. You can also respond to Olivia via that email, or always reach out to any of us at info@connectingforbetterhealth.com if you'd like to add your organization's logo to that letter. Last piece I'll mention is just a thank you so much to our partners who joined us for some local district meetings, both in the North Bay and also in Los Angeles. It was really fantastic to have our clinic partners from Aliados and also from the Community Clinics Association of LA County joining those meetings with staff to really share their perspective on the importance of the DXF and the components of AB 1331 that really matter to their members. So thank you so much. With that, I think I'll just encourage folks to please add your logo to the letter if you're able, and reach out to us with any questions. And we are committed to sharing, as quick as updates as we can when it comes to 1331 as we move through the next couple weeks. Oh, yes, and Olivia just added to the chat here. You can also just private chat her during today's meeting if that's easier, and potentially if we already have your logo on file. Thanks, Olivia. Any thoughts or questions on AB 1331? Alrighty, I think we can move forward. Oh, just an important highlight here. We have been uplifting these really fantastic story graphics around the DXF and 1331 as a coalition. Thanks to those of you who have shared your stories and participated in creating these. They're up on the Connecting for Better Health LinkedIn. Would love if you're able to share them, amplify them, add your own, organization stories and importance to these posts. They've been really helpful when we've gone to these meetings to illustrate the importance of this bill. And look out for more on social media over the next couple of weeks. We'll be very active on the communications front. Okay, moving along.
Hey,
Great.
Stephanie, just real quick this is Tim Valderrama with the Vitamin
Oh,
Group.
hi, Tim.
Hi, how are you?
Yeah, hi,
I
thanks
just
so
wanna
much for joining. Go ahead.
Of course. I just want to, I don't really have anything additional other than to say that the timing right now is extremely important. We have been hearing positive developments in terms of the communication between Wood's office and the administration. The administration has kind of begun to indicate that they're definitely interested in getting the governance and the enforcement mechanisms moving forward this year. As your first slide noted, the bill is an appropriations committee. The timeline for that bill to move would be by August and probably on August 15th. And so, the work that you're doing right now on the letter is extremely important. If anybody has relationships with Senator McGuire or Senator Caballero, those are the two probably most important people that will make the decision about whether that bill moves off of appropriations on the right timeline. And so people that have personal relationships there and are willing to leverage them, that would be really helpful and appreciated.
Absolutely. Thank you so much, Tim. Appreciate that update, and thanks for being here today. Okay. Moving on to our next federal updates. Before I jump into HTI-2, wanted to note that many of you likely saw the announcement this morning on the HHS reorganization and ONC's new name. ONC will be renamed the Assistant Secretary for Technology Policy and Office of the National Coordinator for Health Information Technology. It's consolidating some oversight over tech data and AI policy across the agency. One thing to note, just new roles will be wrapped into this new reorg, including agency-wide roles of Chief Technology Officer, Chief Data Officer, and Chief AI Officer. So interesting developments that will continue to follow at the ONC level. Nikki Tripathi will be the interim Chief AI Officer, but HHS is launching a search for these three leadership positions. There's an informational webinar coming up, so perhaps someone from this coalition is maybe going to throw their hat in the ring. But moving on to HTI-2, earlier in July, ONC released the second Health Data Technology and Interoperability Proposed Rule for public comment. So we wanted to spend just a couple minutes today giving a pretty high-level summary of what was in this proposed rule. And then we have a few of our participants who've graciously agreed to give a few thoughts or key takeaways from the rules. We'll open it up to a broader discussion after this. It's extremely extensive. There's a number of proposed updates, and as always, ONC has prepared a series of really helpful informational fact sheets. They're also hosting webinars throughout the next month or so on many of the components that I'd encourage everyone to check out for more detailed information on any of these pieces. But just really quick bullets I'll run through. The proposed rule includes a number of updates on new certification criteria, including public health criteria aimed at advancing alignment with the CDC data modernization efforts. And it also proposes API certification criterion to advance alignment with CMS on patient access, provider access, prior auth, and others. It also has some additional updates on US CDI, HL7 fire and a number of additional technology and standards requirements, really advancing and building from what we saw in HTI 1. The rule also proposes some revisions to the info blocking exceptions, including 2 new exceptions. We'll cover that on the next slide to really take a look at what those 2 new exceptions are, and interested to hear from the group initial thoughts or takeaways related to those exceptions. And then lastly, on this slide, but certainly not lastly, there's plenty more in the proposal. It establishes some TEFCA definitions and proposed procedures that include QHIN designation qualifications, onboarding processes, and a few other procedural definitions related to those. But we can move on to the next slide and spend a couple minutes on info blocking. So some new definitions just to be aware of in the proposed rule on the info blocking side. First of note, just there's a proposal around clarifying laboratories and pharmacists in these definitions and aiming to bring those definitions in line with other federal regs. But then really what we are curious for your thoughts and questions on are these 2 new proposed information blocking exceptions. So the first new info blocking exception proposed in the rule, and there's also a great fact sheet specifically on the info blocking exceptions from ONC that we'll link in the chat as well, is the protecting care access exception. And this would cover limited sharing of information when it's to reduce a risk of exposing patients, providers, or others for seeking, obtaining, or facilitating lawful reproductive health care. So if an actor were to limit their sharing of information related to reproductive health care that was accessed lawfully in order to protect the patient from potential legal action, it would potentially be covered under this new info blocking exception, the protecting care access exception. So curious just, when we move to our discussion section for any questions or thoughts on how this overlaps with the other recent rules that we've seen around reproductive health data privacy, our conversations around AB 352 implementation in California, and other thoughts about reproductive healthcare data that we've been discussing as a coalition over the last few months. The second new proposed info blocking exception is a request or preferences exception. And this proposed exception would apply when an actor is honoring a request by the receiving entity to only receive a subset of PHI or have it be available under specific timing. So one example that's noted in the rule under this section is a patient specifically requesting a delay of being sent something via their patient portal. So that would not be considered info blocking if the entity was complying with that specific request. And additionally, there's also some proposed amendments to the existing privacy exception and infeasibility exception under existing info blocking regs. I think with that, we'll pause on our summary for a second. I'm really grateful to both Evelyn Gallego of EMI Advisors and Andrea Fry of Hooper Lundy and Bookman, who've agreed to briefly share their kind of key takeaways or comments on the proposed rule. And then we also will open it up to you all for questions, thoughts, discussion. So Evelyn, thanks so much for joining us today. Can I hand it over to you for a quick comment?
Sure. Can you hear me?
Mm-hmm. Sounds great.
Great. No, thank you. And hello, everyone. I appreciate the opportunity to just chime in quickly. I know this is a big rule, so proposed rule takes a long time to read through, but as noted in the chat, ONC is doing a lot of dissemination and webinars. So I'll just start by emphasizing just with my ONC peers that they really welcome public input. So I'll just, it's there, it through the process is really getting the public, all of you, if you have comments, good and constructive, right? So they want to hear if they're on the right path, anything else. So I think it's really helpful for you all as a coalition because you've been advancing a lot. Like when I look at the data exchange framework and what you're doing right now, really much is illustrative of what they want to see other states explore and implement. So I have comments just based on my area of interest, which around social care, data interoperability. So just emphasizing the US CDI requirements. So under DXF, you have US CDI version 2 that is required, that does have SDOH, social determinants of health and health equity data elements. The rule requires US CDI version 4. So that's something for you all to consider, right? To think through is like, how is you're getting your systems in place and your infrastructure right now to align to DXF requirements under US CDI v2, knowing that the systems or the certified technology you're using will have to now then start representing that data with additional data elements, right? So there are additional ones there, a lot even to support transitions of care and health insurance information. The rule strongly emphasizes the use of standards-based APIs. So they have specific fire, so for us, looking at the fire-based standard, they have the proposed rule has new certification criteria for various APIs based on the HL7 fire specification. There's the patient access API, the provider access API, payer-to-payer API, prior authorization API, and the provider directory API. So again, there's lots of that to think through and making it easier to access electronic health information or EHI. Also really, I'm really excited about the bulk fire. So it does have specific data standards for exchange for public health purposes. Again, this is also what we saw as we were building out the sandbox and the use cases there about being able to share aggregated patient data, and it speaks to having or promoting the fire bulk data access implementation guide to support that level of exchange. So I'll stop there. There's, again, big rule, over 1,000 pages, but those are my key points.
Thanks so much, Evelyn. And if folks have any questions for Evelyn or on the rule that you just want us to note and be aware of in continued conversations, please put those in the chat. We also have Andrea on today, Andrea from Hooper Lundy and Bookman. Andrea, any comments or initial reactions from you on the proposed rule?
Yeah, definitely. And thank you, Stephanie, and Evelyn too. That was a great summary of the proposed rule. I just to kind of build off of the comments already made, I do think, the HTI-2 really is very expansive, both in size, being 1,000 pages in comparison to HTI-1 and the Cures final rule, and really brings into the fold, based on conversations that ONC had with developers in this space, with CDC, and various stakeholders. And I think in a really great way to kind of create this broader set of technology standards, certification standards, and really kind of lay down the foundation for this broader national healthcare ecosystem. So, I think it's pretty exciting. I'd say, the big considerations here, just from a procedural aspect, this proposed rule hasn't actually even been published yet. The expected publication date in the Federal Register is August 5th. And just kind of as a caution, that's going to be, usually it takes at least a year or sometimes longer for federal agencies to finalize these rules. And of course, we have this upcoming election, in November. And to the extent, ONC can't finalize this rule before mid-August, I believe is the timeline, there is the possibility under the Congressional Review Act for, say, if Trump is elected, for the Trump administration, depending on kind of the state of Congress in the fall, to overturn the final rule if ONC actually is able to do that. So I think there's kind of a broader question, depending on the state with respect to the election in the fall, whether this rule moves forward. Granted, there is often bipartisan support, with respect to these particular topics, less so, TEPCA sort of stayed stagnant during the Trump administration previously. So it will be interesting to see, but just to kind of flag that as well. And then on top of that, kind of in the legal landscape, we also have the Supreme Court's overturning of the Chevron doctrine in the recent Loper-Bright decision. And so I think there's also a question, to the extent this rule is ultimately finalized, could there be movement by, developers, payers and the like to, push on this rule through courts and essentially, under the new Loper-Bright standards, potentially, get some of the rule overturned. So I just wanted to throw those kind of comments in there as well.
Thanks, Andrea. Much appreciated. Jonathan, I see your hand up. Go ahead.
Hi, can you guys hear me okay?
Yes.
So real quick, thank you so much for the updates. And I just had a question. I have to jump for another call. But in regards to the support letter, we're supposed to notify you if we did not want to include our name and logo for support. Is that right?
For organizations who signed on to the prior letter. Yeah. So Jonathan, we had your sign on from a previous version.
Okay, so yeah,
So just let us know if you don't want it. Yeah.
No, we're good. We're good. Thank you so much. I have to jump
Thanks,
for another
Jonathan.
call, but thank you for all your help. You guys are doing a great job. Have a great rest of your day.
Thanks, Jonathan. Thanks for joining. Okay, one question in the chat. With regards to USCDI and recently finalized HTI-1, any thoughts on the jump from version 3 to version 4 as proposed in HTI-2? Evelyn, any thoughts you want to offer there?
Yes, it's the timing of it. So I think, if you think of version 2, the 2021, version 3, I think the year after, right? 23. So I think they're just jumping because right now they're at version 5. They just published or released version 5. So I think they weren't gonna, I think they just needed to have that incremental. So I'm seeing it more that the jump was related to having it align more closely to what the current version of USCDI is.
And then a question from Matt. Did my imagination or does HTI-1 and HTI-2 contradict one another when it pertains to which version of FHIR to adopt? Evelyn or Andrea, any thoughts on this?
No, that's a good catch. Yeah, it does specify version 4. But that's something good to comment. I know that you can't ask them questions right now because it's a proposed rule, but absolutely include that in your comments.
Thanks, Matt. We'll note that down on our follow-up as well.
And I'll take
sorry, go ahead, Evelyn. Yeah.
No, I'll take it up to the HL7 Policy Advisory Committee also responds to, and that's how I incorporate my comments in through HL7. So I'll note that as well. So thanks, Matt, for checking.
And I have a particular interest in the question as it pertains to the care plan resource and the multiple chronic condition care plan resource, because that's different from 4, which is different from 6 in terms of some of the details there. So
yeah, and just thank you for bringing that up. So we had presented, so HITECH had approved including the care plan as a data class in USCDI v5, and ONC did not move it forward.
yeah, I know it's not in USCDI. I just even though US Core does not include v4 versus v6, it's when implementers are thinking about, right, even things outside of US Core, right, in which even the care plan isn't required in US Core, either of them, we would want to be consistent, right? That are we implementing to R4 of FHIR period, regardless of whether it's in the regs or not, or are we implementing the US Core or to FHIR?
Yeah, no, and thanks for that as well, because the MCCE care plan is aligned to US Core, right? So they're both authored by the same woman, Gay. And so I think that's a good point to call it, to reference here is like which one, because we still need to have more implementation of both the MCCE care plan and the HL7 ELTSS Fire AG.
Thanks, Matt and Evelyn. Any other HTI2 questions? Okay, not seeing any others come in. Huge thank you again, Evelyn and Andrea. Always appreciate you all joining C4BH and lending your expertise and perspective. Connecting for Better Health will be weighing in and participating through Civitas's comments on the proposed rule. So if we go to the next slide on the info blocking exceptions, just once more, there's some questions that Civitas shared specifically to these two new exceptions that I'm going to paste in the chat. Would just love folks to send us an email or weigh in if you have a strong opinion or want to make sure that comments on either of these are incorporated. But as Andrea mentioned, it has not yet been published in the Federal Register, but we're anticipating that happening in early August, which will kick off that 60-day public comment period. Okay, Olivia, I'll hand it back to you.
Perfect. And we can move to the next slide. There we go. Okay. Yeah, we wanted to cover a few other federal updates that have happened over the last month while we've been on a summer break. One that people might have missed is that TEFCA, which is the our national network that's kind of running in parallel to the DXF initiative in California, the Trusted Exchange Framework and Common Agreement. This effort is really pushing to drive nationwide HIE, whereas DXF is really focused on California. And it just to provide some context too, TEFCA was actually established under the 21st Century Cures Act a few years back. But when the Common Agreement version 2 came out, they actually removed some of the operating procedures from it and created separate standard operating procedure documents. And these were released in bulk at the beginning of the month. I'm not going to walk through all the ones that we have highlighted here, but there were a few interesting takeaways. I saw a couple reactions where people described it as, you know, ONC really throwing the kitchen sink at TEFCA, like they're trying to do a lot with expanding its scope right now. One of the highlights is that they are adding a more selective exchange purpose called TEFCA required treatment. And this is to really just deter misuse of treatment-based queries under TEFCA. And this TEFCA required treatment exchange purpose can only be asserted by HIPAA covered entities and business associates. And currently it does exclude health plans. Another interesting update is that there are now transaction codes for all exchange purposes. And this is to add an attestation for the purpose of each exchange type, again, to deter misuse. It also moves, there are also some FHIR updates where it moves facilitated FHIR out of the QHIN technical framework and creates more of a voluntary incentive framework for FHIR-based exchange. And one additional highlight that I wanted to call out is that these SOPs are, which I believe you can find in the QHIN SOP, the QHINs are now required to maintain up-to-date QHIN directories with all the FHIR endpoints included in them. And this is intended to support more targeted queries under TEFCA. And it starts to begin to address this idea of like a national digital healthcare directory. So we'll definitely be tracking that and see what developments might come there. But I'll pause real quick. I'm not sure if others have taken a look at all these SOPs, lots of documents, but would love if others have thoughts or interesting takeaways from this update. And here, let me pop those updated resources in the chat too. All right, I think we can move on to our final federal update. As Evelyn mentioned earlier, US CDI version 5 has been released, and it includes 2 new data classes and 16 new data elements. And I believe with this update being finalized, they're actually now accepting feedback on version 6. So continuing to move ahead. And as Evelyn also mentioned earlier, under the DXF, we're on version 2. So it'll be interesting to see how we begin to catch up to the latest versions that have been released. And I think I can hand it over to Maya now to get into some of our state updates, in particular around our state legislative tracking.
Yeah, thank you, Olivia. So just a reminder that the legislature is currently on summer break and will be returning on August 5th. Moving on to some of the amendments that we've been tracking. Something to note on this slide, AB 236 has removed language that would have required providers that have not been paid in over 1 year to be removed from the provider directory. And it now also requires that DMHC and the Department of Insurance needs to establish a methodology and processes to ensure provider directory accuracy as opposed to just authorizing them to take action. Something else to note is that for SB 957, they have changed the language from SOGI to SOGI SC data and specifies that providers are now required to disclose voluntary information for individuals. Moving on to the next slide. Something to note for AB 2058, it has been amended to also consider devices that have collected or analyze physiology information and now specifies a 2027 effective date for medical device disclosures described in the language. And then on our last slide for artificial intelligence, there's been a lot of amendments, so I highly encourage all of you to read over these slides, but a couple to note for SB 1120, it has been amended to now include disability insurers to be subject to the use of AI, and AB 3030 has been amended to say that violations of AI clinical communication disclaimers are now subject to state medical boards as appropriate instead of naming it as a crime. With that, I will open it up to the audience if anyone is involved in any of these bills or has any other recent updates they would like to share.
Thanks so much, Maya. I think just underlining that when things return August 5th, we'll move super quickly through the month of August. So we'll keep these trackers updated for all of you as those appropriations committee hearings and floor votes happen by the end of August.
I have a question. Are these changes, I think, that Olivia referenced with respect to TEFCA and directories, is that impacting, could you say more about where you started to talk about like national directory implications, and are these changes impacting how California or Connecting for Better Health is thinking about its own directory in the state?
I think that's a great question that I'm not the one to answer, unfortunately, but I think this approach of not having, I guess, or having a network almost a network of, a network of providers, not in a centralized version, but more maintained by this QHIN network could definitely be something that California could consider looking at to help with exchange. And I think we'll continue to, track how TEFCA is moving and definitely pull inspiration from that where relevant for California-based exchange under the DXF. And I'll note too, which we'll get into on the next slide, but as we've been tracking organizations that have been updating their information in the DXF participant directory, indicating what their preferences are to exchange data, 1/3 of the organizations that have registered so far are using a national network or framework. So the DXF and our participants are definitely leaning on TEFCA to support California-based exchange. So yes, lots of crossover there. All right, and back into some more DXF updates. Again, we just wanted to keep everyone on track with what's happened over the last month. As again, I'm sure hopefully people have been taking time for vacation and not on their laptops all day. First, CDI released an updated about the QHIO's explainer, with each QHIO having a full page of information on the regions that they serve, the types of entities that they serve, the types of exchange that they're available to help facilitate. So I would highly recommend that DXF participants take a look at that and use this tool when determining what QHIO they might want to partner with. The next is that the technical standards advancement process has been finalized, and this is going to be used to update DXF standards on an annual basis. CDII is looking to begin this process in 2024 to consider advancing standards around updating US CDI from V2 to V3 under the DXF to align with the new federal requirements. And they're also looking for recommendations on the technical standards for ADTs. And in relation to that, they are right now accepting applications for the DXF 2024 Standards Committee. I'm not sure if they're planning to have a new application process for each year, but currently they are accepting applicants for the 2024 standards that are going to focus again on US CDI and ADTs. So if you have technical expertise in this area, they would love to have you. And you can find the link to the application in our slides. Oh, and one other point of clarification too, the DXF Standards Committee is not replacing the task, which is they have task has an upcoming meeting at the end of August. So these are two separate committees. All right, and we can move to the next slide. We really wanted to drive it home the importance right now of going in and updating the DXF participant directory. If you've signed the DSA, that's really the first step. All DXF participants are obligated by the PMPs to go into the DXF participant directory and indicate their technical preferences for exchange on how they want to exchange health and social service information under the DXF. You can access the participant directory through the DSA signing portal. It's the same link and same account information. So if the person who is going to be maintaining your technical preferences for exchange is different from the person who had the authority to sign the DSA, you can contact CDII and they can transfer ownership of your organization's account to the right individual. We want to note that the DXF participants themselves are required to update and maintain their choices. It's not the QHIOs. They're not able to go and update this information on your behalf. And also organizations that are not required to exchange until 2026 still need to go into the participant directory and indicate that they're exercising this option to delay. And we've been hearing questions and would love others' thoughts as well. But one question that people have been having is, all right, if we go in and add our technical preferences to the participant directory, like what's the point? What's the utility of this? It's really to help others learn how your organization is preferring to exchange under the DXF to kind of help kickstart conversations on how you guys might connect. CDII is releasing, I believe, weekly. They're updating the participant directory listing, which is in CSV format, and you can go through, it's a big spreadsheet, and you can see how organizations have indicated their preferences. And relating back to the DXF sandbox that we launched earlier this week, and let me pop that link in the chat. We're actually inputting this listing into our sandbox to help create visualizations. So you can go look at a county level. I don't think we're at the zip code level, but you can go look at the county level and see who in your community is actually participating in the DXF and begin to explore different types of partnerships there. I know that there are a lot of visualization capabilities for people to explore. See, we have one question in the chat, how the QHIOs get the updates from the participant directory. I know that the QHIOs have their own work group right now to work on QHIOs exchanging information amongst themselves. And I guess, Matt, would you want to clarify your question a little bit? And what you mean by like updates from the participant directory?
Of course. So the success of obviously of data exchange is going to be dependent on having the right information within the QHIOs, obviously, right? So are the QHIOs like, you know, do they have some kind of cron job where they're loading the CSV and then uploading it, you know, to update their records to maintain the accuracy of their records? That's the direction of the question is, you know, is this being done via exporting the CSV and then updating the data that way, or is there some other EPI? Is there plans for or more, you know, a real-time process, or, you know, that kind of thing?
Yeah, thanks, Matt. I think we could open that up to our QHIOs. Any of our QHIOs on the line today want to respond or weigh in about the utility of the participant directory to your DXF implementation efforts?
This is Becky Shoemaker from SkyO. We go in manually and pull down the directory each week, and then we have to manage manually. Currently, there is not a way to programmatically update or deal with this. So we do discuss it in our weekly meetings, but it's basically a manual process across the board.
Does that take a lot of time?
Yeah. There's challenges with the directory itself. We don't have the NPI numbers for the organizations. We only have a name and address. So it can be tedious because we're focusing on the participants that are in our regions for the most part, but identifying who you're working with or contracted with to reach out to them and have it updated, it's time consuming.
Maya, I think we can move on to our final slide on this. We do have a couple tips for organizations as they go in and discuss the participant directory and go in and actually update their information there. It's very important just to make sure that your organization has taken the step to complete the participant directory beyond signing. And also remind your partners about it. I think it's definitely word of mouth and, you know, boots on the ground efforts to make sure that we get everyone's information updated in there. We also request that while participant directory can be a mouthful, try not to refer to it as the PD, because this can get a little bit confusing with the health plans provider directories. So when you're discussing it externally, would highly recommend trying to say the DXF participant directory. And we've also heard that there's been a bit of confusion around the 3 types of exchange. So when you go in and enter your preferences in the participant directory, there are 3 types of exchange for you to fill out. The first is your choice for requesting information. And this indicates how you as an organization would like to receive requests. This is a field that all organizations are required to fill out and select a method. The next, which there's a bit of confusion on, is your choice for information delivery. And this indicates how you as an organization would like to receive health and social service information. In particular, this is really relevant for like push notifications. I would say most entities or all entities can select a method here, but some may choose to select non-applicable if they're not interested in receiving these push notifications. And the final one, which we want to be very clear on, is the choice for notifications of ADTs. This is really only relevant for hospitals, emergency departments, and skilled nursing facilities to fill out. And this indicates how these organizations, so hospitals, EDs, and SNFs, how they would like to receive ADT notification requests. And this information is really indicating like where other organizations should send their patient rosters. So if you are not a hospital, you're not an emergency department, and you're not a SNF, you should be putting in not applicable. I know that CDII is doing work right now to clean up this information if there have been mistakes on the back end, but wanted to clarify that this is not for all entities to fill out. It's mostly for the hospitals, the EDs, and the SNFs. There are also available resources. So we have there's a walkthrough that CDII has on their website with presentation slides and a video. The how-to guide has been recently updated with screenshots to really walk you through the process. And again, you can always reach out to CDII if you have any questions and need some help. Sorry, just taking a look at the chat. Are there any questions related to the participant directory?
Just thanks to Jacob who weighed in around updating users. Jacob, not sure if you're interested in coming off mute and clarifying that, but it sounds like that might be helpful info for everyone to have.
Yeah, CDII is able to actually make this change ourselves. Unfortunately, no one else can make that change, so it does have to go through us. But if you reach out at DXF at hhs.ca.gov, we can make that change. All we need to know is obviously which organization it is, the name of the desired primary contact, and the email of that person, and we can make the change.
Great, thanks, Jacob. We can put that info in our next newsletter and slide too, so folks know. Alrighty, thanks, Olivia. I think we're close to wrapping up here. Want to go to our next slide? Olivia, you want to share this?
Yes, I'd be happy to. Thank you everyone who's been a great partner in developing the DXF Community Sandbox. We now have a platform available that's internet-based, so everyone can go in and access it. Even if you're not a DXF participant, but you just want to learn more about it, individual users can go in and create an account and go play around with our visualization tools. There are also features in there that we're continuing to build out to help support use case testing and synthetic data exchange testing. To be really clear, the data that we have in the sandbox is synthetic data. It's no PHI, no personal information. And we're continuing to build out the capabilities that organizations themselves will be able to go back and forth and engage in use case testing. And I think that's it. We added the link in the chat. We've already seen a lot of individuals go in and create accounts and sign on. I'll just add to that, while you as an individual go in and create an account, the next step, if you are a DXF participant, is to go in and actually register your organization. And you can find the button to do that on the left-hand toolbar all the way down at the bottom. And this is how your organization can begin to engage in that use case testing and data exchange testing. And definitely reach out if you run into any issues there. We're happy to help troubleshoot. All right, I think we can move on to our next announcement. And I'll let Maya hop in here.
Yeah, thanks, Olivia. Some things that we're also reading this week. As we already mentioned, there is a new CDII QHIO explainer resource. We also highlighted a health affairs article about enhancing contraception access through EHR integration, and also highlighted a piece on hospital engagement and awareness of TEFCA that was created by the ONC. And then lastly, here are some upcoming events that we want you to be aware of. One to highlight is on August 21st, CDII is reconvening their task force for their third round of meetings. And with that, I'll hand it back to you, Olivia.
Thank you. I think that is our meeting content for today. If you want to pop onto our final slide, Maya, just as a reminder, C4BH is engaging in technical assistance to support DXF implementation. We have our next DXF bootcamp coming up on August 1st. I believe we're at capacity for that event, but if you're interested, feel free to still register and we'll put you on our wait list. And in addition to our bootcamp for our DXF technical assistance, we're also currently working on use case development through our DXF Community Design Studio. And And we also have our sandbox to actually help go in and do some testing and validating of these new use cases to help orgs establish their workflows. So thank you everyone for engaging in this, and definitely let us know if you're interested in partnering further. I'll
Thanks,
pop our
everyone, for
Google
yeah.
form. Sorry, I'll just pop our Google form back in the chat real quick. So just a reminder, August 1st is the deadline to sign on to our AB 1331 letter. But Stephanie, I'll let you wrap this up.
No, just thanks so much, everyone. So nice to see you all. Appreciate the conversation. Noted down the questions that came through the chat and from you all. We'll see you in 2 weeks. Have a good rest of your day.
Thank you.
Thank you all. Great seeing you.